We're moving away from chemotherapy already. The patient population who we still are using chemotherapy for are patients who have a mutated immunoglobulin heavy chain gene. Those are patients, for example, with FCR who get a very deep remission with their first treatment with FCR. Many of them, more than half of them, will go into a remission and will remain in remission more than 10 years. And we've discussed the possibility of those patients being cured. So the chemotherapy strategies for that particular population that we're developing now are with an intent to limit the exposure to chemoimmunotherapy, still maintain the benefit that they get from the chemoimmunotherapy, but reduce the exposure and potential toxicities that we see with chemoimmunotherapy. For everybody else, we're using non-chemotherapy treatments. And so I think where we will go where we're going right now actually, and in the near future, in the frontline setting is combinations of treatment, combinations of small molecule inhibitors, with or without the CD20 antibodies, where we're giving a defined treatment course, whether that's a year of treatment or 2 years of treatment, getting most of the patients in a good deep remission and giving them a treatment-free break. The data that we will need to be generating moving forward is how long do those remissions last, when do we start them on retreatment if their disease comes back, and how do we treat them when their disease comes back, and how do they respond to retreatment with small molecule inhibitors when they get retreated after their disease comes back. But I think in the frontline setting, we're going to be seeing very, very deep remissions and very, very long remissions. And again, we have a number of drugs that work by different mechanisms of action where we're learning how to combine them and take advantage of the mechanisms of actions of each of the agents. And so outcomes with CLL are extremely good now, and I think what we will end up seeing in the not too distant future is a survival with CLL that's similar for individuals who don't have CLL. It may require some treatment for the CLL, but I think the survival will be similar.